But I personally think fear is never good. I say it's really not a healthy feeling.
Hello and welcome. You are watching Lockdown TV from unheard.com. So since the start of this pandemic, the discussion has got quite acrimonious and people have been divided on one of two camps, whether they are in favour of restrictions or more sceptical. Well, one voice that has become quite a famous one, on Twitter at least, is Professor Francois Balloux. And I'm delighted that he is joining us down the line from Lausanne in Switzerland. Hi, Professor Balloux.
Hi, it's a pleasure to be here with you.
I would say that you're a voice that is sort of grouped with the more sceptical side, but has managed not to go native. And I guess you still retain the respect of both sides. How have you pulled that off?
Well, that's very kind of you. I hope that's the case. Well, I don't. I really try to behave as a scientist. I try to comment. I try to advise and share my views. But I don't think scientists should really be involved in devising and implementing policies. So I think there needs to be a divide between the scientists who advise and the politicians, the politicians who really kind of take decisions on behalf of the population and to the benefit of the population.
So I want to come back to that and talk about that in a bit more detail, but let's kind of begin by just focusing on the kind of science. Do you think it is wise for a government like the UK, so we're being specific, to attempt to suppress this virus indefinitely until a future moment which might come with a vaccination, if that works, or whenever? Or do you think we need to do something different?
Yeah, you're obviously touching on a very sore point, which I would say is probably the major true disagreement among scientists. Say some people believe it can be suppressed, it can be eliminated, and others don't. I personally believe that the window of opportunity, if there had ever been one, which, let's say, where we actively knew it was circulating and was not too late. I'm not actually sure it was really possible, let's say, at least in many countries like Italy or most of Europe, actually. I'm not sure there really was a time where we could have said, oh, we do X and Y, and it's gone. Now, also, what does gone mean? To some extent, elimination, to me, would mean global elimination. Let's say, as long as there's a focus, as long as an epidemic somewhere, let's say, we cannot really go back to a real world. And I really think people might underestimate what closed borders mean, let's say, both for us, but also for other countries, in terms of, let's say, indefinitely having closed borders, what it means in terms of global hunger, in terms of, let's say, other infectious diseases like TB, tuberculosis, or children diarrhea, or all these diseases. Let's say, I think the toll might just be absolutely awful. So we need eventually, and as soon as possible, go back to an open, globalized world. And I'm not saying that as a globalist. Let's say, I'm really saying that from a kind of public health, from a kind of let's say, to minimize, let's say, harm and morbidity and mortality in the long term.
So it sounds from that answer that you don't think that indefinite suppression is, if it ever was an option, it certainly isn't anymore. Is that fair?
Well, yes, that's absolutely fair. I'm not even sure it ever was, and I think it definitely isn't now. And yes, I really cannot understand how anyone would wish to suppress it forever. We have to be a bit careful with words here, obviously, because we'll, at some point, as soon as, well, hopefully fairly soon, we'll have vaccines, which will make it much, much easier. I don't believe that vaccines, as helpful as they will be, and as useful as they will be in terms of, let's say, reducing morbidity and mortality, let's say, they won't be a silver bullet. They won't allow us to suppress the virus. I really think we need to face it, that the virus is here to stay.
You mentioned vaccines, and that is obviously the kind of other variable in this calculation. A lot of people who are very strongly advocating an activist policy of suppressing it for now say, well, it might only be 6 months, and then there's a kind of end point in the spring or perhaps slightly later next year where it would have been worth it to go through all of this pain because we kept deaths low until we reached the kind of golden moment of a vaccine. You think that kind of thinking is wrong-headed?
I wouldn't go that far. I completely understand the argument. I'm not convinced we can put the. I'm not sure we're talking about 6 months here. Let's say sure. I think within 6 months we should, in all likelihood, have vaccines that are effective. That said, in 6 months we won't have, let's say, the ability to mass vaccinate the global population. So that will take a lot of time. There are several complications here, but let's say even in an absolute ideal world where everyone were happy to be vaccinated and we have the perfect vaccine with very little side effect, a vaccine that also can be given to essentially everyone, including the immunosuppressed, let's say, including children, including the elderly. Even if we put ourselves in a completely ideal situation, I doubt we're talking 6 months here. I really doubt it.
So in other words, it's going to be later, and even when it happens, it's probably going to be less effective than some people are hoping.
Some of the vaccines look pretty good. It is a bit unclear whether there will be so-called sterilizing, really. I think they will all, in all likelihood, be quite effective at reducing symptoms drastically, so that people will essentially do very well and essentially kind of asymptomatic or very light symptoms. But I don't think we can gamble on having one sterilizing, infection-blocking vaccines.
Even a vaccine that stops symptoms would be transformative because you can then vaccinate elderly people and people with serious other conditions that can be comorbidities, and then bingo.
That would be the case. We have to be a bit careful because some vaccines are not always suitable for the entire population. Now, we can hope, but all this, when we say we can hope, essentially makes me feel a bit uneasy because we cannot just gamble everything on, let's say, things working out. They are just trade-offs. And essentially, depending on what one thinks are the most important things to protect or to achieve, this will create some disagreements. But fundamentally, there's no single perfect solution. And I think banking entirely on a vaccine and saying, oh, it will be here in 6 months, now it will be difficult, we put the world on ice, and that's okay. Let's say 6 months I don't think that's a very reasonable approach.
So what would a reasonable approach look like?
Well, reasonable often is pretty unappealing. Again, there's not a unique solution, and it needs to be flexible, it needs to be adapted. I'm often not that convinced about measures over, at least for large countries. I'm often not that convinced that the measures should be necessarily at the national level. I think much more targeted measures often have more potential.
But what does that mean? That means, there's national, there's kind of regional. What about just individual? So each individual can then, or each family can choose what kind of risk appetite they have, and with guidance from the government can make their own minds up.
I think that works best in a society where there's considerable trust in the authorities. And yes, there is obviously the really effective public measures essentially are the ones that people buy in, the ones that people don't feel forced to do. They do it because it's been explained well, they find it meaningful, and they just think it's good for them and it's good for the community. Now, that can be difficult to achieve at times, especially if the communication has possibly been problematic before, and some of the trust is lost. And it will be quite difficult to regain this kind of trust to really count on people doing what, let's say, is kind of ideal. I really don't believe in fear. And I think fear is bad on several levels. I really would like some real efforts to reduce this climate of fear. Concern is good. let's say people should be responsible, but I personally think fear is never good. Let's say it's really not a healthy feeling, especially over a long period of time. It's actually even physiologically it's not good. It's not good for mental health. And also, let's say one thing we should not underestimate is, I don't want to sound like Yoda here, but I say fear really, essentially, it doesn't just evaporate. People are not suddenly, oh, fear is over, now we're happy again, now we're confident again in life, and so. So fear really tends to turn into anger and resentment. So this is something that worries me a lot.
So in other words, presenting people with worst case scenario charts at number 10 Downing Street briefings as a kind of way to try and nudge the population, that's the phrase that we got used to after a famous book a few years ago, is not long-term a healthy way to try and direct people's behavior.
Yes, personally, but that's very personal. I would prefer to see some slightly less blanket measures and letting people decide a bit more about exactly the level of risk they'd like to be prepared to live with. Now, there's a real challenge here because obviously there need to be real measures that allow the people who want to stay at home or even to want to isolate, let's say, to be given this possibility, which I think is not the case in many countries at the moment.
Yeah, but the cost of providing people the resources or a safety net to be able to choose their own risk level would be a tiny fraction of the cost of shutting down the whole of society, which is what we seem to be preferring at the moment.
It would. I would also say it's might also be a tiny fraction of the sums that have been kind of circulated for some major testing initiative that would test everyone every day, all the time, forever. So yes, I think I could imagine that some targeted investment to let people choose a bit the level of risk they're confident and comfortable with could actually be reasonably cost effective given the current circumstances.
You mentioned testing just a moment ago. I just want to pick up on that. The answer given normally to how we kind of can open up more confidently is by improving testing. That's the kind of easy critique always of government. The testing isn't good enough, it's not fast enough, there isn't enough of it. What's your view on that? Can we test our way out of this, or should we be doing less testing?
I think well-targeted testing can be extremely effective at reducing transmission. Now, to be effective, testing needs to be fast and needs to be coupled with effective measures of tracing. It can take all different forms, but also then measures of isolation. And when I mean isolation, I would not necessarily think it's good enough for someone to be told, now you can't see anyone for 14 days and you have to stay in your room. Because let's say, I think there's a bit more to at least humane and effective isolation of people than just telling them, now you're not allowed out or whatever. So
where would this more targeted testing be focused then? I mean, does that mean testing tens of thousands of school children every day is not a good use of tests?
I'm personally not entirely confident this is good use of tests, yes. I think I really, it's slightly complicated because the most effective use of test is when a disease is a relatively low incidence or low prevalence. And you have few cases, and if you have an effective system in place, you can identify the ones who are affected, and either working forward, backward, you can really identify the other ones, let's say close contacts or contacts that have been affected, and it's very effective. It can be a very effective measure to reduce transmission. Now, in the presence of a lot of transmission, it is a bit more questionable how effective testing is. And let's say when an epidemic is in full swing, I would even say it might be possibly a waste of resource.
So we should still test, I guess, hospital staff or people in care homes, but you think there's no point kind of looking for asymptomatic cases? Where do you draw the line?
I would say specific testing of frontline medical personnel, specific testing of people who work in care homes, or anyone who works with people who are at risk, I think would be probably a far more effective and measure than, let's say, blanket testing of people. And yes, and the question with testing in schools, I really don't think it's a priority. I have to admit that I feel slightly uncomfortable about this drift towards testing everyone every day. I feel a bit worried, at least in the long term, about the medicalization of society. I think diagnostic tests are very precious. They're very important. And for decades, let's say, their use has been really optimized. And I mean really optimized in the sense that the people who should be tested are people, we should, let's say, test people when it is really worthwhile. By worthwhile, I mean testing people when there's a fair chance actually to detect something.
I.e. they have symptoms.
Yes. So it is obviously we're entering a completely new era about just testing kind of widely people who are not necessarily symptomatic. I cannot think of anything similar before. Never. Let's say it completely, let's say in terms of medical and scientific ethics, it is completely novel and different. And it raises some, I would say, very severe question that surprisingly no one seems to, or essentially no one, except a few ethicists, seems to really kind of think about.
In other words, it gives a perfectly healthy person, it makes them into a medical problem.
I think there are multiple ethical problems. COVID-19 is interesting because we still don't know exactly the proportion of asymptomatics, but it seems to be fairly high. To be absolutely honest, or to put that in context, I would say we know that, for instance, for influenza, we know that at least we have good data for the 2009 influenza pandemic, that the proportion of asymptomatic cases was around 50 to 75%, which is probably could well overlap with what we're seeing for COVID-19. So it's not unique in that sense. Actually, many things that that's a bit interesting. We all obsess about COVID-19. We think, oh, it's so different, it's so unique. But let's say, in some sense, at least for geneticists, it's a pretty boring virus. Let's say it has fairly high case fatality rate, but let's say it is not that special. But our approach to it is completely different. I don't think, and that's globally, I don't think the world has ever kind of reacted to an epidemic or a pandemic in the way we do, which raises lots of complicated questions.
What would you say the ethical problems with this kind of mass testing of otherwise healthy people might be?
I'm not that worried about, let's say, a short period of time or over a short period of time, let's say, there's an outbreak, let's say a resurgence. I'm absolutely fine with having a lot of tests, a lot of people tested. What I really wouldn't want to see is that we slide or we drift into kind of a routine or a world where this is becoming normalized. I think that's extremely dangerous. I think for all these COVID interventions, there is no real, unique, perfect solution. These are really societal choices. These are moral, ethical choices. These are not scientific problems. I say the scientific problem, and we can do that fairly easily. We can say we predict that transmissions in the community might be reduced by X if we test that many people. But let's say that's it.
And what if you don't want to be tested?
Yeah, that's an interesting question.
Yeah, this is why I think we are going to come back to some kind of more individual regime, because if let's say a third of society, by virtue of their personalities or politics or whatever it is extremely upset and stressed and worried about this and wants maximum suppression and testing and everything they can possibly think of, and another third of society has just decided they would rather carry on living their lives and take whatever slightly elevated risk that entails, those two groups are not going to agree.
What I resent, or what I'm really unimpressed with, is when actually these completely valid different views to view what freedom is. Let's say either we could put more emphasis on one's, let's say, risk-free life or one's freedom to do X or Y. So what I find unpleasant is when this is kind of forced on some kind of narrative that people of this kind of are evil, or let's say it's all, let's say, people with whatever right wing or left wing view are evil because they don't sympathize with other people's, let's say, values of what freedom means. But at the moment and for a little while, I think everyone will have to, should, let's say, really compromise on some of the things they believe are individual freedoms.
We're almost getting to this sort of big question of values and how people think about the things that are important to them. There is one message you put on Twitter that I'm going to read out here. One worry I have about a side effect of the COVID-19 pandemic is that some of our societies might turn into de facto technocracies. I find the current obsession with statistics, diagnostics, health metrics, and comparison between countries unhealthy. Expand that a bit for us.
Well, we all witnessed, let's say, how much, let's say, or at least my world, and I guess yours too, and I think most people's world has changed. And one particular aspect I really don't value at all is this obsession about comparing different places, different countries. They did X, they did Y, we did that. And it's really not helpful, and it's really not healthy. And let's say there's not much to be gained. Now, I'm not saying that we shouldn't, from a scientific and very technical point of view, we should obviously do our best to understand which measures work where. But let's say that the entire population gets obsessed about, let's say, whether, let's say, COVID-19 is going up or down in Germany is a bit insane. I really don't think this is good.
It's that's where it's technocracy, because it's almost like a slice of reality that can be put on charts, and that's easy to talk about and easy to compare. So everybody has the discussion at that level, whilst there may be real world variables that we don't know about, seasonality, genetics, the places in the world that are affecting this in ways that are actually much more important than the things on the charts. Are you saying that there are things in society that are more important but can't be put on a chart and therefore are invisible to the technocrats?
The problem is more, let's say, these kind of constant obsessions. They obviously have very important impact on policy, on, let's say, political decisions, and probably in the long term. And I really don't think that our whole societies should turn entirely around health or public health. And because it's actually not something particularly nice. Let's say I've worked for many years on infectious diseases, I worked on tuberculosis. Let's say it's grim. Let's say essentially I've spent a lot of time counting people who died, people who didn't die. They died because they had this drug, they got this drug, didn't die because they didn't get this drug. And before I could kind of partly rationalize that, I could, let's say, sometimes forget about it. But say, at the moment, I feel everyone's kind of having this kind of hobby or job, or whatever you call it. And it's not something easy. It's not something very joyful. And including actually whatever, children and everyone, it's not ideal. Let's say people should not obsess over death.
So are you saying, do you mean that actually it can be better for society and better for public health not to kind of obsess about one particular danger or threat in the way that we're doing. And some things are almost better sort of kept out of sight.
Okay, there are two things. I think COVID-19 needs to be put in some perspective. It's obviously a very severe public health crisis. It's the most severe we had since, let's say, HIV/AIDS and or the 1957 flu pandemic. But let's say life, to some extent, goes on, and there's still other causes of death. There are people dying of other conditions. And yes, I would say COVID-19 needs to be put in some perspective in people's minds. But also more generally, it's not just putting COVID-19 perspective, but I say I don't think people should obsess all the time about, let's say, the risk of dying of cancer, of dying of heart disease, of dying of COVID-19. I think there really needs fairly soon to be a way for everyone to take a step back and, let's say, just to be a bit kind of more carefree, a bit happier. And say we cannot live like that for very long. It's very unhealthy.
I mean, what many people might say to that is that if you get people to relax more and start being more joyful, then your infection rate will go up and more people will die.
I'm actually not absolutely sure. I think there might be ways to ensure that people, let's say, behave in maybe equally effective ways in terms of, let's say, limiting transmission, but being slightly less worried and, let's say, having a kind of more pleasant life. I really think that's possible. Well, I can tell you it's possible because, for instance, I am currently not in the UK. And let's say what I see around me, and the situation is not that different from the UK. It's slightly better. There's minor resurgence. So I'm Switzerland. Yeah. Okay. So there's a slight minor resurgence, but let's say there's not the same kind of level of panic and angst and problem. Let's say, and the people behave, yes, reasonably responsibly, and I think that's really what we should try to aspire to have an as normal as possible life. And obviously, if there's a very severe resurgence, let's say if things are at risk of getting out of hand, then sure, measures need to be taken. But also then the population probably, let's say, everyone understands why. Let's say no one is prepared to see hospitals being overrun. Let's say no one wants that for all sorts of reasons, but also because most people are actually decent. But let's say creating a constant climate of fear is really not something. I also find it possibly even very counterproductive, even if the objective is just to reduce transmission. I think one thing we have to consider is that we might have a wave, let's say a wave or a serious resurgence this winter, something a bit more serious than we have now. And I think there was really a missed opportunity over the summer just to not to give people a respite and also, let's say, to circulate a more positive message. And by positive, I don't mean things like it's over, don't, let's say, get crazy. I think just something a bit more hopeful. Also, something I regret a little bit is quite a few countries, it depends a little bit, but let's say there is no real, all the messaging is actually quite negative, tends to blame people for bad behavior, and there's also no real, very rarely, kind of a real sense of what's the end point. Let's say, what can we hope? And it's not about lying to people. And I think good communication in terms of public health and science is really about, let's say, being very clear about the uncertainties and making it very clear that the evidence changes and, let's say, the situation could be kind of reassessed. But I think it's absolutely critical that there needs also to be some kind of positive message. Let's say, when can we hope this to be over? Let's say, or we are hopeful even, and it can really be nuanced enough to still be positive and yet, let's say, not say things that aren't happen.
I wonder whether there's something cultural going on. I mean, you're in Switzerland, I've spent time in Sweden earlier in the summer, and it does feel that there is something about the kind of Nordic countries, Holland, Germany as well, and down into Switzerland, where there is a sort of cool-headedness about this kind of policy issue. It's less hotly political, and there's less of a kind of, sort of existential dread hanging over the place.
Well, definitely. I think some of the countries that have done well in the terms of messaging, and obviously there's a lot of disagreement whether Sweden did well or not. I think where Sweden did well, because we have to talk about Sweden at some point, to say where it did well is really about, let's say, the quality of the messaging, let's say the focus on encouraging people to do things rather than coercion. Actually, there are some other countries in Europe that had very similar strategies and they don't get that much abuse for their kind of more, let's say, mitigation type approach rather than suppression type approach. For instance, I would say, could cite a few countries, including Switzerland, where it would be difficult to pretend that there was even ever a real attempt at suppressing the epidemic. Now, we have to face it. Let's say typically Sweden and Switzerland had pretty high mortalities, particularly in care homes. And yes, there were major mistakes made. Let's say even care homes were not well protected, and I think everyone accepts that. However, I think these kind of approaches work best in a society which is not too polarized, where there's a reasonable trust in the government. I think, let's say, the countries that navigated that well, let's say psychologically at least, like, let's say, Sweden or the other Nordic countries too, or Switzerland, or Austria, or Germany even, let's say, there's quite a bit of trust in the government. I think that's extremely helpful. And it's really a virtuous kind of circle. It's really a virtuous dynamic. Let's say if the population has some trust in the government, then the government is probably more prepared to be open and honest and transparent. And this feeds obviously more trust. And yes, I think some governments have handled that much better than others in Europe.
It almost feels like we are thinking about COVID-19 more as a kind of cultural crisis than a straightforward pandemic. We talk about how these different countries are being tested, and some countries in the group that we're talking about in Europe seem to be okay. The UK is shaky, and the US is very, very divided, and it has not responded at all well to this. So it's almost like it's a test of the strength of these countries' cultures. And in that case, it's more of a cultural crisis than a straightforward health crisis.
I agree with you, but I'm not sure actually any major pandemic is just a health crisis. Let's say, well, just think about HIV/AIDS. Let's say at the beginning, I was very young, but let's say I remember it was quite dramatic. And let's say it went far beyond just, let's say, a problem of people being unwell and transmitting. Let's say there was a real deep moral crisis. And the 2009 pandemic never really materialized. Let's say it looked actually quite bad initially. I was involved in the team at the Imperial College that was also advising the World Health Organization at the time. And initially looked quite
alongside Professor Ferguson.
Yes, exactly. And it really looked COVID-19 bad initially. Actually, the initial first evidence, the kind of CFR, if you want to say, case fatality ratio from the early cases from Mexico looked so bad that I'm quite relieved it wasn't communicated to the public. There were the 57 and 68 flu pandemics. 68 was relatively mild. 57 was very severe. So it was kind of COVID-19 severe in terms of mortality adjusted for the number of people who were around at the time. It's actually very comparable. And it's very difficult to actually judge whether people reacted in a similar way, when they were equally worried. Apparently, the measures that were taken at the time were obviously much less drastic. Let's say in the previous flu pandemics, there was no lockdown, there was no closure of borders, no school closures, which is interesting because obviously pandemic influenza has a very high mortality rate for children. Sorry, that's actually not true. I think 57 and 68, there were some school closures. Sorry for that.
How do we get back into a better position? How do we get from here to where we want to be?
It depends a bit what you mean by where we want to be, but obviously the pandemic will eventually be over. Now, it's difficult to give exact dates, but let's say based on what we know from previous, let's say, influenza pandemics, which by many aspects actually are epidemiologically kind of have similarities, I think we have to brace ourselves for possibly a very difficult winter, possibly another wave in the spring, and then I would say plus or minus a few months, I think the pandemic phase of COVID-19 should be over by, let's say, mid-end of next year, 2021. And this, interestingly, well...
Are you counting on a vaccine doing that, or are you counting on, how do you get that? Or do you then say it just becomes one of the kind of seasonal coronaviruses like all the others?
Yeah, maybe not like all the others, because the other four are actually very mild. I think it will take a while for us to acquire the kind of population immunity that really, let's say, most people have been exposed, and let's say it really goes down to... It's not just coronavirus. We have something like 200 respiratory viruses in circulations, all sorts of viruses, which to someone who is not healthy, or let's say someone who's immunocompromised, or the elderly, or sometimes children, can actually be pretty unpleasant. So we sometimes forget. Typically, for instance, it's just a bit of a, let's say, typically, for instance, mortalities and outbreaks in elderly care homes is nothing new. Let's say they happen all the time. They've always happened. Now, obviously, COVID kind of amplified these, but let's say it's really nothing new. But to go back to, I want to be very careful here. I don't want to make very strong predictions, but let's say my guess is that the kind of pandemic phase of COVID-19 will kind of fizzle out next year towards the summer, or maybe slightly later. That doesn't mean there won't be, let's say, little outbreaks and so on. And then it will, in all likelihood, become endemic. So essentially, yes, there will be cases. And there will be cases probably for a very long time. We'll just join one of the many, many viruses in circulation. How long it will take actually to really it to be one, we can not worry more than all the others. That might take a while. So it will obviously not from one day to the next. Maybe it might even be difficult for us to say, oh, the pandemic is over, because there will always be cases of outbreak. But at some point, it will just decrease and decrease.
What is it that we should think about first and foremost, do you think, between now and then?
Well, I think the most important message, if there's a one, is that it is a severe health crisis, a very severe one. And I understand that everyone's very worried and very fearful, and this is completely understandable. But I think the most important point is that it is not the new normal. It's not like that forever. Let's say by the end of next year, in all likelihood, maybe give or take a few months, let's say we will be back, essentially. We should be back.
The old normal.
Well, that's obviously a societal decision. It won't be completely the old normal, and maybe there are even some real benefits. Maybe, let's say, there are some positives. Let's say, I think the way I think there might be some real positives, few, but let's say still few positive to kind of learn from this major crisis. But when I mean normal is a time where we don't obsess just over death and statistics and, let's say, cases, but let's say where people just get on with their life. Let's say they follow their dreams, they do things that are meaningful, and with some optimism and joy and the sense that life is worth living.
Hear, hear. Well, Francois, Professor Balloux, thank you so much. That vision of the future, I can definitely sign up to. I suspect most of our viewers will as well. If we could just fast forward to that moment, that would be great, but I guess we can't. Thank you so much for your time.
Thanks to you. That was a really nice discussion. Enjoying it.
That was Professor Francois Balloux from the University College London, but joining us from Lausanne in Switzerland. We got quite philosophical there. I hope you enjoy it and gave us a little bit of hope at the end. So thanks to him and see you next time.